Hi, I'm Dr. Brad Shook, and today I'd like to talk to you about the new science of naturally helping psoriasis and autoimmunity. And today, what I'd really like to cover with you are a lot of things that you may not have heard about, the approach that I take, a science-based approach that's really focused on trying to support your immune system naturally to help you put psoriasis and autoimmunity into remission, or at least dampen the process so that you can have better quality of life without having to consider or utilize some of the more invasive medications or therapies that are available. So what I'm really going to focus on with you is a three-step process that we use in our clinic to help us figure out what people need to do to improve their autoimmunity. And it really revolves around detecting the problem, removing the problems that have been detected, and then repairing the damage that's been done. We're really looking for drivers of the immune response. So why is your body attacking itself is a question you should be asking yourself if you have autoimmunity or psoriasis. And it really, if you think about it, the immune system is designed to protect our body. But for some reason, with psoriasis and autoimmunity, it's attacking itself. So what we have found is that there are a number of things that drive the immune response and that promote immune system dysregulation, loss of regulation, that if we can identify them, we have a very good opportunity to dampen the autoimmunity and really try to get improve your symptoms and your quality of life naturally. So we're going to talk about the causes, testing, and natural support. I want to welcome you, and I'm excited to get started. Functional medicine is really what we're going to talk about today, and it is really a perspective on autoimmunity that seeks to look at the drivers or the causes of the problem so that we can remove them from your body, from your environment, so that you're not triggering and driving that autoimmunity. Now, it's really important to understand that autoimmunity has a genetic component. So you have a genetic predisposition towards autoimmunity. If you have psoriasis or any other autoimmune condition, you have some genes that are predispose you to that particular autoimmune condition. But the genes don't cause the condition. It's really it's a combination of the genes and your environment. So the environment activates the genes that causes the expression of the autoimmunity. That's very important to understand because we can't do anything about the genes, but what we can do is if we can identify those environmental triggers, the things that activate and that cause expression of the genes and expression of the autoimmunity, and we can remove those or we can dampen those, then we can change the genetic expression and improve the autoimmunity. And that's really what we are seeking to do here. Now, if you've never heard of functional medicine and you're not familiar with it, then I want to share some information with you that you probably don't know. This is a picture of the Cleveland Clinic. It is a very prestigious hospital. They do a lot of research there, and they are one of the first hospitals to do heart surgeries, maybe even the very first hospital to do a few different types of heart surgery. And they have brought to their hospital functional medicine, probably the first, if not one of the very first hospitals, major hospitals, very reputable hospitals, to put in an entire functional medicine department. So this stuff is not things that are necessarily just on the fringe here of acceptance or of scientific validity. This is something that people that are visionaries know is important, and that a lot of people realize that the public wants. People want to be healthy naturally, and that's really what we're talking about here. What's causing you to be sick? Can we figure that out? Can we do things naturally? And if we can't, then we do have a lot of other tools, and there are things available from a medication perspective and from a surgical perspective, but everyone wants to know, can I be healthy naturally? They don't want to be on medications forever. The Cleveland Clinic knows it, and a lot of people realize this, and everyone will tell you, sure, I want to be healthy naturally if possible. That's what functional medicine is. That's what it seeks to do. Now, I work with autoimmune patients for a few different reasons here. When I was about 12 years old, I had severe irritable bowel syndrome until I was about 17. I mean, it changed my life. It caused me to lose a lot of opportunities and to change the things that I was doing, change plans socially, to do a lot of things differently, even in sports and in football. When I was playing football, it affected me very significantly because I had severe constipation. My stomach always hurt, And it was a terrible experience for me. And that was the first thing. And no one could tell me what to do. None of the doctors. I mean, everyone was like, "Well, just take laxatives and eat more fiber." And you know what? Sometimes that's appropriate, but sometimes that can actually create more problems. And for me, that didn't significantly help. Taking psyllium husk and different types of fibers and eating high fiber foods. No, there was something else at play that was contributing to my irritable bowels. And you're going to learn that the gut has a very direct connection to the immune system. Your intestinal walls are barriers. They are selectively permeable barriers that allow foods and digesting foods and the nutrients that your body needs to pass through that wall into the bloodstream. And if that barrier system breaks down, it can predispose you to immune problems and to autoimmunity. So I had those problems when I was 12 to about 17. I mean, I was diagnosed with ADD and ADHD when I was probably 6, so first grade. And that, I think, looking back, was also probably reflective of my diet, because I grew up in the 80s, and there was, of course, a ton of carbohydrates. That's when, like, there was the high carb kick. Everything was fat was bad, and there was a high carb kick, and there were lots of processed foods and additives and preservatives and a lot of other things that are still in foods, but there was less known, right? So I had a lot of problems when I was really young, and then irritable bowel syndrome, very significant from 12 to about 17. At 25, I was diagnosed with psoriasis. And that's when I first realized I was autoimmune. I didn't know until then. And I just couldn't accept the fact. The dermatologist told me that I could use steroids, and if it got bad enough, I could use immunosuppressants. And I just couldn't accept the fact that my immune system was attacking my body, and that's just how it was. There had to be a reason for it, right? This is my immune system. It's designed to protect me. If I cut my hand heals all on its own. So I know my body's always working to preserve me, so why is it destroying my skin? It just didn't make sense. So that's where my journey began of determining and learning about autoimmunity and what drives it. So I was 25. That was 15 years ago. And so I go through this long journey. I start learning about the gut and the gut's role and the importance of a healthy digestive tract for immune system function. And I seek out formal training, and I learn about functional medicine and epigenetics and precision medicine. I start learning and reading as much as I can, and I started formally training in functional medicine and, again, epigenetics and precision medicine. And then I guess when I was 30, about 6 years ago, I was really tired, and I was running some labs on myself, and I decided to get some thyroid antibodies because I started seeing a lot of people that had thyroid autoimmunity, and I was like, I should really check this and see what's going on with me, because I had periodic fatigue, but I was brushing it off as being I'm working too long and I'm staying up too late. A lot of the things that you really have to consider and change if you're autoimmune. And sure enough, I had thyroid antibodies, and that's when I knew I had a second autoimmune condition. I had expansion of the autoimmunity, and that I had to make some really serious decisions and change what I was doing. And that's really where I really transitioned into functional medicine, precision medicine, and epigenetics coaching almost exclusively. And so this is my journey. This is how I got here, and I've gone through lots of different training that I'll talk about in a second. But what we're going to talk about is the latest science in autoimmunity and understanding it. And we're going to talk about this functional medicine perspective and how it's a lot different than just treating symptoms. Which, listen, there's nothing wrong with treating symptoms. That's a very valuable thing to do. If you can give someone relief, that's of value. That's of significant value. So I'm going to talk about the differences there. And the goals that I really have for the presentation is just to give you this new perspective and then to make a positive impact on your life. Hopefully this will give you some inspiration and at least information to become your own advocate so that you can be more active in your own health care and be a better partner with your doctors. It's really an important thing for me, is to teach people and give you a different perspective. And then just give you information to improve your health. So I do want to share something with you. I am a doctor. I have a doctorate of chiropractic. And not a lot of people understand or know much about the chiropractic degree, but I've had 8 years of school. I had 4 years of pre-medicine. I had organic chemistries and college level physics and general chemistry and biology, all the pre-medicine courses that a medical doctor would have. And then actually in chiropractic program, I actually have more hours than a medical doctor has. We have slightly different emphasis on the core curriculum. But so let me give you an idea here. So requirements for admission to chiropractic school: I had to have a bachelor's degree with pre-medicine, right? Organic chemistries 1 and 2, college physics 1 and 2, biology 1 and 2, and then all the other stuff that I don't want to say is not as hard, but yeah, the other stuff, right? Those are the weed out classes, so to speak. So all these things here, I had to have all these to get into, just to apply to a chiropractic college. And then degree requirements. So to graduate with a doctorate of chiropractic, I had to have 456 hours of anatomy and embryology, and you can see the medical curriculum is 215. Physiology, I had to have 243. Medical schools 174. Pathology, I had 296. They had 507. So medical doctors get more pathology because they're obviously looking for a lot of pathology. So you would hope they have pathology training. Chemistry and biochemistry, I had 161 hours. They had 100. Microbiology, 145. Diagnosis, I had 408. They had 113. Neurology, 149, and they had 171. Psychology, psychiatry, chiropractic college, 56, and 323 in medical school. Obstetrics and gynecology, I had 66. They had 284. X-ray, I had 271. They have 13. And then orthopedics, I had 168. They had 2. So, I mean, I had a very, very heavily weighted in physiology and anatomy, obviously, because I worked my degree had a greater emphasis on musculoskeletal care, but there was a ton of chemistry, lots of chemistry. You know, arguably in a lot of these areas, physiology more, right? And so very important. Total hours for the degree was 2,419 hours. Medical school was 2,047. So the hours are significant, you know, and the education gave me the backbone, the basic foundational understanding of how the body works to be able and study functional medicine. So this is just required to understand the physiology, to have a background so that I can study and understand functional medicine. Okay, so that's my part of my background. Now, my postgraduate studies, lots of different postgraduate studies. I'm not going to go through these line for line, but I have studied at this point probably well over 1,000 hours of postgraduate studies in functional medicine, and I love it. I mean, it's really my life. I enjoy it, and so it doesn't feel like work, right? That's probably the good and the bad, because that's why I stay up until midnight sometimes. So or beyond. So I've done a lot of different training, I've had the opportunity to learn from some very brilliant people, and I'm very fortunate for this opportunity to have the opportunity to be able to learn this and to try and help people with their health. So let's talk about autoimmunity and get all that other stuff behind us. So autoimmunity is really what we're talking about with psoriasis. Okay, autoimmunity is a hugely it's an epidemic level. In the United States, there are millions and millions and millions of people with autoimmunity, and there are millions and millions of people with undiagnosed autoimmunity. This is at epidemic levels in the United States and across the world. Our immune systems are attacking our bodies at greater rates than ever before, and there are a lot of different reasons for that. I'm going to share a lot of those for you. So to understand, you know, autoimmunity and what's happening, you've got to understand how the immune system works. So very basically, you have two different parts of the immune system. You have white blood cells and you have barrier systems. Now remember, I talked about the GI tract barrier a little bit earlier. Well, that's a barrier system, and it keeps things out of the bloodstream that shouldn't be there, yet lets things through into the bloodstream that helps the body with normal physiological function, like amino acids and vitamins and minerals and all that good stuff you need for your body to work normally and repair. So you have several different barriers. We'll talk about them in a second. And you have these blood cells, okay, which are a really important part, obviously. They help you fight off infection. Now, the white blood cells have two different categories, okay? You have, on this left over here where you've got the soldier, you have Th1, which is called a cell-mediated response. So it's a cell, the cells And this is an immediate response. It's kind of like that pus around the splinter. This is something these cells go to an area and they attack. Okay, their immediate response. And then you have on the other side the Th2 system, which is called a humoral response. This is a delayed response. This is where you produce antibodies in the blood, and these antibodies are kind of like sticky notes, as you see here with this little slide. There's sticky notes, and they stick to things that they're made for, and that sticky note's a tag that marks that thing that it's stuck to for destruction by other cells that come behind and eat it up. This also gives your immune system the memory. That's where you can look to see if you have they can do a titer to see if you have immunity to a virus or something. So these are the white blood cells, two different Th1 and Th2, right? Now, in a well-regulated immune system, what you have is you have balance here. If this is we're looking at like a seesaw here, and in the center, the Th3 system, which I'll talk about in a second. The Th3 system is called the T helper system, and the T helper system, T helper 3, what it does is it sends out and it produces chemicals that help regulate and balance the immune system, so that it doesn't become lopsided, so that you don't have a really high amount of Th2 or high amount of Th1. It keeps them in balance. Now, occasionally the body is going to shift to fight off infections and whatnot, but really the Th3 system helps to regulate and keep everything in balance. Now, with autoimmunity, when your immune system becomes activated or it becomes out of balance, okay, when the Th1 or Th2 system is stimulated or suppressed, you get this imbalance in cells, this oftentimes will activate something called the Th17 system. And the main thing you need to know about the Th17 system is that it is very inflammatory, and it creates and promotes a lot of tissue destruction and damage. So we don't want a lot of Th17 activation unless it's necessary, right? Unless there's an infection, and we need, these are all essential pieces of the puzzle, but it needs to be normally regulated and optimally regulated. If it's dysregulated and you have an overexpression of these inflammatory chemicals, then this can pose and create a lot of problems for our health and for our immune system. So this is where, when the body attacks itself, that polarity, the shift, as I said, in Th1 or Th2, the cells, drives an activation of interleukin 17, which is basically, all you need to know is that's an inflammatory chemical that really creates significant tissue destruction. So we don't want that, right? We want normal balanced immune system, and we don't want it to be dysregulated. Now, when you think about this, you say, well, why would my immune system do this, right? This is what I was really thinking about when I had psoriasis. I was like, well, why in the world would my body attack itself? And the dermatologist she said, we don't know. And you know what? She was being very honest, and I appreciated that, and I respected her, and I do appreciate what she did for me. But there are two different things that we have discovered that contribute to activation of the immune system, and especially prolonged activation, and that is really things that either are called active antigens, so they stimulate the immune system for a long period of time, prolonged activation. So, with infections, your immune system attacks it, destroys it, and the infection's gone, and then the immune system returns to normal. Well, active antigens are things that really drive the immune response over a prolonged period of time, so it doesn't go away. It's constantly stimulating the immune system. And then there are things that are dysregulators, things that cause the immune system to not be able to normally balance and regulate itself. So the dysregulators are what we're going to talk about first. And so this wonderful looking pile of food, some people might say, is full of trans fats, of potential food inflammatory triggers, of carcinogenic compounds, of food additives like nitrates and nitrites, of byproducts of the cooking process like acrylamide. This is a loaded cancer cocktail, quite frankly, and immune system dysregulating cocktail. And so inflammation is this type of food can significantly drive an inflammatory response in the body, and it has a lot of bad fats in it. It has very high omega-6 fats, which are a type of fat that we need, but in the standard American diet, we usually have about 25 to 50 times the amount of omega-6 to omega-3 fats. The omega-3 fats are the ones that tend to be more anti-inflammatory and that balance the immune response. So this high amount of omega-6 fat and all these additives and byproducts of this type of cooking are horrible for our immune system and can drive and cause us to lose immune system regulation. Okay, so our immune system is just not able to balance or regulate itself properly due to this imbalance in fats. You know, and there's a lot of different problems. Of course, I've mentioned several things with this picture of food, and they're, you know, so this is very significant. Diet plays a very, very significant role. Your nutritional status plays a very significant role. That's why one of our primary tools is diet. Okay, very important to understand. Number 2, bad blood sugar and stress will cause dysregulation. You know, I could go on and we could do a full 1-hour presentation on this, but I don't have time, and you would probably, you know, your eyes would just roll back in your head and you go to sleep. The main thing here is this. Blood sugar fluctuations drive inflammation. Fluctuations up or down of blood sugar will cause fluctuations in your insulin levels. Insulin is inflammatory by nature. When your insulin spikes, you produce interleukin-6, which is an inflammatory chemical. And this also will create a lot of problems for your sex hormone production. This will create a lot of problems for your neurotransmitter or brain chemistry. Okay, so this is a major issue for regulation of the immune system. Everything is connected in the body. That's the one thing that you have to appreciate. That's the one thing that I've learned and that I appreciate more than anything is the connectedness of all the systems of the body. You can't just look at one system when someone has, for example, a skin problem or what looks like a skin problem. So you just look at the skin and you say, hey, you've got psoriasis, it's a skin problem. No, it's an immune-based problem. The skin is the target of the immune system, so you have to address what's driving the immune response. It's just like with the autoimmune thyroid people that have Hashimoto's. It's the immune system attacks the gland, and it's not the gland, it's not the endocrine system that's the problem, it's the immune system. And then, so there are a lot of examples that we could go through like that. So you've got to look at everything and not just, you know, one system that you think you know or that you have an answer for. You've got to look at how everything is connected. Hormone imbalances. Hormone imbalances, you know, if you don't have enough estrogen, if you don't have the right amounts of testosterone and progesterone, if your cortisol is up and down, you will have difficulty with healing of your barrier systems. Remember, your GI tract wall is a barrier. You have a blood-brain barrier. You have a lung barrier that keeps things out of the bloodstream that shouldn't be there. When those barriers break down, that's when you start getting a lot of immune system activation and a lot of problems occurring, like autoimmunity. So hormones are important for a lot of different reasons, but when it comes to regulation of the immune system, they also have a profound impact on immune cells and immune regulatory function. So you have to be aware that the hormones are very important. Neurological imbalances. Now, you might say, well, what does the nervous system have to do with this? Everything. It has a lot to do with it. So you have a voluntary and an involuntary nervous system, and your involuntary nervous system is called your autonomic nervous system. Okay, you don't have any control of it. And one part of the autonomic nervous system is your sympathetic nervous system. You may know it as the fight or flight system. Okay, that fight or flight system can be driven by any type of stress, emotional stress, physical pain, and chemical stresses like inflammation will all drive a stress response. And what does that do? Well, it triggers a lot of different things. Pupils dilate, you stop producing digestive juices, your bronchi, which feed your lungs, they relax, so they open and dilate. It accelerates your heartbeat, so your heart beats faster. I mean, just imagine the last time that someone jumped out and scared you. Heart rate goes up, you're breathing faster, right? That's a sympathetic fight or flight response. You've activated the fight or flight response. When you do that, you produce a lot of stress hormones. Your body is not in repair mode at all. You can't digest food in that way. And what's happening is today, we are living in a perpetual state of sympathetic nervous system activation. We're stuck in fight or flight mode, and our bodies never have a chance to repair. So this is really important to understand. And there's a lot of other physiological changes that occur. So we have to have normal immune regulatory function. We have to have normal nervous system activation and a balance between the fight or flight and the rest or digest system, which is sympathetic and parasympathetic, okay? Very important to understand. Poor absorption will cause dysregulation, and there are a lot of different reasons here. I'll just tell you though, if you cannot get vitamins, minerals, and nutrients from your food into your blood, then the biochemistry cannot occur normally. And immune regulation is dependent upon a lot of different vitamins. Vitamin D is very important for immune regulation. Vitamin A, vitamin K, vitamin E. Those are all fat-soluble minerals. Minerals help with immune regulation. You have to have adequate minerals. So these are all very important things that can be disrupted by a bad gut. So poor digestive tract can have an impact on the immune system. All these things are connected. That's why we want to look at them. There are also things that can drive the immune response. These are the active antigens I mentioned. And food sensitivities are absolutely something that can stimulate the immune system chronically, driving an immune response, perpetuating the autoimmune process. So the foods activate the immune system. The immune system ramps up this production of immune-based cells against foods, and those foods may have similar protein structures to your own tissues. So they have mimicry, they look similar. So the immune system may attack your tissues thinking it's that food protein coming in and perpetuating the immune process. Now, that's called molecular mimicry. That's one of the theories of autoimmunity. And it's something that's very important for you to understand because a lot of people deal with, and have reactions to foods. And we can measure this in the blood. Okay, we can measure this to try and understand how to remember, detect your problems, remove the problems, repair the damage, right? Detect the drivers, detect the immune triggers. So food sensitivities. Hidden chronic infections. Infections drive the immune response. Parasites, bacterial imbalance, different types of fungi. You've got viral infections. All these things can drive an immune response. So you've got to be very aware of anything that can drive the immune response. Okay. Environmental toxins. We know now that environmental toxins, they bind to our tissues in our body, and a lot of them do, and that can trigger an immune response against your tissues and this new complex of chemical and human tissue, which can promote and drive the immune process as well. So it's very important that we understand, the big things for me are food sensitivities, pathogens, and chemicals. Understanding if the barrier systems are intact are important too, the blood-brain barrier, the leaky gut to see if that's present, and then looking at hormonal regulatory function, and also looking at your foundational chemistry. Okay, your inflammatory levels. Can you carry oxygen? Do you have stable blood sugar? Those are really critical things. Leaky gut or intestinal permeability. Now, if you don't know what this is a breakdown of the gut wall that lets proteins and bacteria, lots of things through into the bloodstream before they should ever be there. Some things let some things in that should never be there. So let me show you how this works. This represents what you're looking at here. This represents the GI tract lining. Okay, these are called enterocytes. You see the little finger-like projections here. Those point into the GI tract. So up here above those things, that would be the inside of the tube of the GI tract. So imagine food is floating through here, and on the other side of these cells, there's a blood supply where the nutrients pass through the GI tract wall into the bloodstream. Okay, so let me show you how this should work. So normally what you're going to see is that the cells of the GI tract have these proteins that hold them together. So you see these little yellow things that appeared on the screen. These are called tight, the space here are called tight junctions between these beige-like cells that you see. And what you see is that above and below, you see these yellow things that are forming here. These are the proteins that hold the cells together. So these are called adherens junctions. They hold the cells together. Now, what's important to understand is that as the food that you eat, which has a lot of proteins, fats, and carbohydrates in it, as it passes through the GI tract, they come in and there's a complex. They're bound together. So you see these little colors here. They're meant to be kind of like a chain of protein, or a chain of amino acids that make up a protein. As they come through, they're so big that they bounce off of the GI tract wall. They're too big to pass through. They can't get into the other side of the bloodstream. So you have enzymes that work on them, like digestive enzymes and hydrochloric acid, your stomach acid, that break these things down into the individual amino acids so they can pass through, because now they're smaller. They're not this big molecule or complex. They pass right through into the bloodstream. Now your bloodstream, your body has these building blocks that are needed, and it can repair and rebuild, right? So that's really important. Same thing with fats. Fats come in, They're too big to pass through, but you've got these enzymes that break them down and allow them to pass through between the tight junctions here. But they're small enough to pass through, and the gut lets them through. The barrier, the GI tract wall lets them through very selectively, right? It doesn't want big things to pass through or bacteria to pass through that could stimulate an immune response. Carbohydrates are the same way. Too big, they break up, and then they find their way through. Now that's normal function. Now what happens though is that with fast food and coffee and a lot of these other things, GMO foods, medications, steroid, different types of anti-inflammatories, Tylenol, Advil, lots of different things. Wheat can do this in some people. Lectins, which are anti-nutrients, steroids, stress, alcohol, different types of oils like transfats, soda, which is incredibly acidic, food additives, preservatives, everything. These things start to have an effect on the GI tract. They start breaking it down. And then what happens, now you've got this big gap. You notice that some of these junctions are broken open. You see that the adherens junctions, the tight junctions, are now torn open, and there are these gaps. So what happens is when you eat these foods, now, before they're thoroughly broken down, these big pieces of these proteins, they can pass right through into the bloodstream before they should be there. And what ends up happening is that as these proteins pass in, they stimulate an immune response, and that's called leaky gut. That immune response is one of the things that perpetuates, and we believe initiates even, autoimmunity. So the scientific literature now says that leaky gut is a prerequisite to an autoimmune disease. So this is very interesting. A lot of this research has been done by Alessio Fasano at Harvard University in their celiac department, and he is a pediatric gastroenterologist, so he studies the gut of children, and he is one of the foremost experts in this field. He actually discovered zonulin, which is one of the proteins that hold those cells together that we were just looking at. So if you don't heal the gut, you will have chronic inflammation and the immune system stimulation. So we have to look at a lot of different things. Are the barrier systems broken down? What's triggering the immune response? So that we can try to figure out what's driving the immune process. And so to address the causes, there are a lot of things we've got to consider, right? Food triggers, gut health, adrenal gland function, anemia, inflammation, thyroid function. We've got to look at these environmental chemicals, all of these things, these chronic infections, to understand what your unique drivers of the autoimmunity are, or otherwise you're just guessing. You're just guessing. So you've got to test all these things to figure it out. If you don't test them, you're really going through a lot of trial and error, and it can be next to impossible to figure out. So this is very interesting when you start looking at insurance, because people have asked me, we know, are any of the tests covered by insurance? No, none of them are covered by insurance, because here's a very interesting quote. This is straight out of Medicare guidelines. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. So they will pay for you when you're sick. When you're sick, it's necessary. When you're trying to extend health or prolong health, it's not necessary. It's considered elective. So you might argue, in fact, say, you know what? I've got psoriasis over my entire body. This is not elective. This is necessary. Well, according to their treatment guidelines, though, and to what they can do and what they determine to be necessary, which is the standard of care that's been set up by orthodox medicine. This is something that does need to be changed. I agree. I would advocate change. This is the standard of care. So what you're getting is a standard of care. If you're happy with what your doctors are doing and what your insurance covers, then you're in the right system. But if you're not happy with that and you feel dissatisfied and you don't understand why your immune system is attacking your body, then you have to say, you know what, I don't agree with this system and with this approach, and you're going to have to decide, make a decision to pay for your own testing and be your own advocate and get the testing done out of your own pocket, quite frankly. That's what it comes down to, and that's what we see very commonly. And I think it's very important that you understand that perspective. Medicine is designed to help you when you're sick, and you might say you're sick, but it's acute sickness, so you just become sick, they help you. Chronic sickness, long-term sickness like chronic autoimmunity, they will help, but their definition of help is based around the current state of the science and what they and the insurance companies agree is necessary, and they determine that. You don't determine that. I don't determine that. They determine that what's medically necessary is the medications that they recommend, and the interventions that they suggest. Which, listen, there's not a conspiracy here. The fact is that they're trying to reduce cost and help as many people as possible. And quite frankly, they're not educated in functional medicine, genomics, and precision medicine. They're not. This is new science. This hasn't made it into medical schools. So there's a lot of shortcomings. There's a lot of problems with the system. So you've got to understand that insurance does not cover any of this kind of testing. They don't. So, you know, people pay for all kinds of stuff, right? They pay for cosmetic surgeries. They pay for a lot of things that they want. You know, this is one of those things that you have to, you know, what's your health worth to you? You have to pay for it sometimes. And the good news is that if you have health savings accounts and things like that, those can help towards some of the costs of this type of care. And you know what? It doesn't even have to be expensive. It can be. You can spend $10,000, $15,000 on testing if you wanted to. You absolutely can. Or you could say, you know what? I'm going to start with some dietary changes. I'm going to start with some supplementation and some things and do some trial and error. And you know what? There's very likely that you would see some improvement there as well. So there's a huge spectrum of things that you can do. The main thing is that you educate yourself on options and you understand some of the new things that are occurring in healthcare. So the current model, I've already gone through this, right? Insurance driven, it's not based on current literature. It was not designed to address the cause. It was really designed to address and help symptoms, which is huge, huge. It is profit driven. It's very, very profit driven. I mean, look at the most lucrative businesses in the world. They're drug companies, right? They sell drugs, they advertise drugs on the TV. My kids are watching drug commercials. I think it's absolutely ridiculous. That's the doctor's job to determine what kind of drug you need. You shouldn't be involved in that at all. There should be no marketing to individuals. It's just ridiculous. Doctor education comes from drug reps. I mean, that's the truth. So are they ever going to hear the kind of information? Very, very likely not. What can you expect with this model? Well, that's the question that you have to, you already know that. You can expect these things: drugs, procedures, and just suppression of symptoms without understanding of driving factors and cause. And this is a valuable model, guys. Don't get me wrong. This healthcare in our current medical system is fantastic at acute care, short-term problems. If you're broken or you need you need a heart transplant, this is where you want to be. This is the type of care you have to have. But chronic conditions, autoimmunity, inflammatory processes, diabetes, all these chronic conditions where the body breaks down over a long period of time, this model of healthcare that we currently practice, the orthodox medical care, is absolutely not efficient. It's not effective. It doesn't have an answer for it. So, there's a time and place for everything. And the fundamental problem is just how we look at health. And so here's an interesting concept. I really like this because I think it makes a lot of sense, and a lot of people agree with this. So you're unhealthy, you go to your doctor with a symptom, right? You tell the doctor, hey, I've got a headache. He says, well, here's a medication for the headache. And you say, okay, I'll take it. And so your symptom's gone. But what are you left with? You're still unhealthy, right? You don't know why you had the headache, right? So you're taking this drug, you still got the symptom. Now another symptom appears. You say, doc, you go back and say, doc, now I've got really, I feel like my head's going to explode. I'm very short temper. I have a very short temper. I don't know what's going on. Doctor says, you know what? You've got high blood pressure. And so what does he do? He gives you a drug. What happens? Takes away the symptom, right? But what are you left with? Now you're on 2 drugs. You're still unhealthy. The cause and driving factor was not addressed. So now what happens is another symptom appears. You go in and you say, doc, man, I am fatigued. I feel tired. I am absolutely exhausted. I don't know what's wrong with me. Doc says, okay, you're fatigued, you're tired, you're sore and tender all over. You know what? You've got fibromyalgia. So let me give you this antidepressant. And what does it do? Well, if you're lucky with fibromyalgia, it takes away the symptom. But what are you left with? You're still unhealthy. So how does this make any sense? How does it make any sense? I get it, right? I get that its symptom relief is important, but at some point we have to start saying, why is this person's body breaking down? Or do they have the foundational basics that they need to live a decent, normal life? Or am I just medicating the hell out of them, causing them to have more symptoms? And guess what? Now these drugs are causing another symptom. Now you're getting a side effect from the drug, which the doctor may not pick up on. So guess what happens? You go in and you get another drug for the symptom for the drugs that you're taking. This is completely unacceptable. We have to do better than this. And these are valuable tools. Medications are valuable tools, but we have to think, how in the world are we going to keep, the masses of people healthy? We're just going to throw medications at them? That doesn't fix the problem. It covers the symptom up. It might prolong life. There's a lot of value to medications. But we have to start looking at what it means to be healthy again. We have to start looking at nutritional status and infections and these chemicals and all these environmental impacts, and we have to put the power back into people's hands to be healthy. And people that are chronically sick, we've got to help them figure out how to unwind this mess and figure out what's driving the problem. So, what can you expect from this model? You can expect a lifetime of medications that have serious side effects. That's what you can expect. That's what you can expect. And you've got to ask yourself, is that what you want? Is that going to give you a good quality of life? Are you going to be able to do the things that you want to do in life? You're going to be able to be there for the people that you love, your kids, grandkids. You're going to be able to travel. You got to ask yourself those questions. Progressive deterioration of the tissues being attacked. That's what happens. That's what happens with unchecked autoimmunity. Expansion of the autoimmune condition to other tissues. We know that people that have autoimmunity, about 50% of them have another autoimmune condition, at least one. And once you start losing self-tolerance and your immune system starts attacking your tissues, all the tissues are on the menu. So you've got to ask yourself, how important is your health to you? And it's priceless. It's the only thing that once it's gone, it's very difficult to get back. There's also no strategy to get you off the medications, and you're told that there's nothing else we can do. I mean, how many times has a doctor ever said, hey, we're going to put you on this medication and we're going to try to get you off? It's rare. It's very rare. I work with a lot of people, and it's rare. You very rarely hear anything about this, because you're put on them and there's just no strategy. It's like, here you go, you're on this forever. And a lot of these medications were never designed to be taken for a lifetime. Never. So you got to ask yourself, why do you have the problems that you're having? Why are you autoimmune? Why do you have psoriasis? Why is your body attacking itself? And how do we get an idea of what's contributing? Well, we have to look at these factors we've already talked about. You have to ask the right questions. You have to get the right tests. You have to do a detailed health history. I mean, you have to go deep. You have to look at the person's, when this started. You have to look all the way back at things that could trigger autoimmunity, contributing factors, stressors, antibiotic use, infections, everything possible that we can tie together to try to figure out the trigger and anything that could be perpetuating and driving it. You got to get the needed testing regardless of what's considered medically necessary. You have to do what you have to do. You get to the why and don't just treat the symptoms. You've got to figure out what's driving the process. So this is one of the questionnaires that we use. When we look at every system in the body, I don't care if you have psoriasis. I want to know about your digestive tract. I want to know about your blood sugar regulation. I want to know about your stomach acidity. Do you have reflux? I want to know about your electrolytes. I want to understand your thyroid. I want to know about hormonal symptoms that you're having. I want to know everything about every system that I possibly can, so I can look at the big picture and try to figure out what is the weak point, what are the weak points, what can we do at one time to help improve your systemic health as simply as possible, to improve your immune system regulation. So here's the deal. If this is something that you makes sense to you, if this is something that you're interested in, then you can learn more by going to drbradshuk.com. That's our website. You can go there. You can explore the page. If you're interested in scheduling an appointment, I work with people around the world. I do consulting with people in other states. I work with people in other countries. We can help you get laboratory testing. I can help you assess what's going on and put together a plan and a strategy to try and get your health back. And if you're autoimmune, to dampen the autoimmune process. I can help you with supplementation, and we can work together to try and get you as healthy as possible. But you can go to drbradshuk.com, go to the application for care page if you're interested in working with me one-on-one. I only work with a few people per month on a one-on-one basis, so you can go there, learn about the application process. Please read the entire page, read all the frequently asked questions. It will answer the questions about cost. It will answer the questions about the process that we go through. And it is an application. I do not accept everyone that applies for care in our office, not because it's anything personal, but simply because if I can read a health history and I can look over, we have you submit forms prior to the appointment. And if I look over that prior to the appointment, which I always do, and I take extensive notes, and I determine that I don't think I can help you, I will let you know. Okay? So it's important that you can go there, drbradchuk.com, application for care page, and you can learn more. And you just go there and you can request an appointment, and my staff will assist you from there. But I hope this has been helpful. I really appreciate you guys joining me today. I know this is a long presentation, but this is important that you understand. If you have psoriasis, you're dealing with autoimmunity, and you've got to take an approach that looks at why this is occurring, not just cover it up with steroids and immunosuppressants. You really got to look. The model that I take, detect the problems using repeatable testing, immunological based testing. Detect the problems, remove the problems you detect, repair the damage. That's the key. That's what we found to be successful, and that's what we can consider helping you with if you think that you'd like to try to work one-on-one. But I appreciate you. Hope you have a wonderful, wonderful day. Talk to you again soon. Thanks.